for this webinar. I was asked to talk about the health side of things. I'm not an educationist, and to give a very brief overview of COVID-19 and where we are as a continent, and somehow set the scene for the rest of the webinar, which is more about school opening and how the education system has been impacted by COVID-19 in Africa. So I have a medical background, and I'm an epidemiologist. And depending on where you are in this pandemic, that's a good thing or that's the worst thing that could happen. And so I was asking myself what I should talk about, and I decided to not give too many numbers, but to give context from the perspective of somebody who believes that health is not just about hospitals, that health is a function of many things. It's a function of the information system, it's a function of the political system, and many other things. So I titled my talk about COVID-19 in Africa, and whether it's really a new normal or whether it's a normal that we have defined for ourselves. So the first few slides have just some numbers that I've picked from the latest WHO website about where we are. And this is a graphic that shows the number of confirmed cases in the Africa region as of today. So for those of you who have been following how COVID is progressing across the world, I think you've heard of the term the second phase, and I think we can safely say that Africa has started the second phase from around the early parts of October, that the numbers have gone up. These are numbers, these are tallies of daily cases reported from all the African countries. Now, the graph for death is not very different, but we know that death usually lag cases by about 2 weeks. So if you looked at the number of deaths, 2 weeks is, becoming sick, and then the peak of death is around 2 weeks. So in a few weeks' time, you'll probably start seeing the second wave of death, if at all it materializes. But I usually say that Africa is not a country. So when you look at this totality of the number of cases in Africa, or the number of deaths in Africa, they actually mask very huge differences between countries. I picked 4 countries, and for those of you who know will know why I picked them. It was by chance, but then they ended up being those countries. So the first country is Burkina Faso. And Burkina Faso has an interesting pattern because really the COVID-19 never materialized as one would have expected. They've had consistently very low numbers, and their peak was about 200 cases sometime in September. But then they've had cases which are consistently, around 50, below 100 throughout the pandemic. And so the blue lines show the number of cases, and the black lines show the number of deaths. So their deaths were around, the peak for death was around April. But then after that, they have very low numbers, and the country has opened up, schools are back in business. There are hardly any restrictions for COVID-19. And we can see that their daily case tally is around maybe 20. So that's one country. The second country that I picked is Kenya. And so Kenya, the numbers for around April and March, things were very, very down. And then we had our peak sometime in August, and now the second wave is truly underway. So what you see in the African map really is an average. It's averaging out the Kenyas, which have very high cases, going up, and then the Burkina Fasos, where the number of cases are going down or stable. And in the third graphic, we have Senegal, which had a very, I would say, prolonged peak from sometime in May that went all the way to September. So the numbers consistently high, around the 150s. But right now, Senegal, they are getting single-digit numbers or less than 10 cases per day. And the number of deaths are tracking around the same numbers. So Senegal also has open schools, offices are open, they're back in business. And then last but not least is Uganda. So Uganda seems to have been late to the game, hardly any cases registering on the graph for much of the pandemic until sometime in September when the numbers started going up. And so it's hard to say whether Uganda is having the second wave, whether it is the first wave. I don't know what wave that is, but really it shows that the trend is, consistently upward. So much as we're looking at Africa as a continent, we need to understand that every single country has its own context, it has its own patterns, and the patterns are explained by different factors. And so even when you think about what it means for school opening, we have to see how the different country contexts influence the choices and decisions that are being made around the COVID response. So I think generally speaking, those are the only numbers I have in my presentation. It's that I would say they're mixed fortunes for African countries. Some are just getting hit, others have been hit and the first wave has not even ended, and others are experiencing the second wave. And in terms of the responses, it's clear that one size does not fit all. And I think currently there are very few countries with hard lockdowns that we experienced around March and April when COVID first hit. And many countries have eased restrictions. So for instance, you find in Kenya, what was a Nairobi lockdown now is a curfew. So there are many countries which have eased restrictions. And for many countries also, I think, as I said, to understand other or policy as they think one thing gone up. This is a picture that perhaps you didn't expect to have seen. Because and society, their risk tolerance is much higher. There are some memes for those of you who follow social media who say that previously when they would make an announcement of 100 cases, people would be shaking in their beds, but now they say people can be locked away forever, and how much you can put restrictions on people's movements and social interactions and activities. So once people get tired, then they start taking more risks and they start doing a lot of things. They stop listening to advice, they stop being anxious and scared. So this fatigue also is a factor in how much, in the kinds of choices people will make. And I think this is something which is quite unique, maybe not just unique to Africa. I think we've just seen this happening in the US, that politics is politics and political campaigns will trump everything. And these are graphics from 3 East African countries. There's Kenya on top, there's Uganda. Actually, the procession in the middle, which is the second graphic, is the Minister of Health as she was getting nominated to be a member of parliament. That was the procession following her right in the middle of the pandemic in Uganda. And then below that, of course, is Tanzania. So when you start tracking some of the COVID cases in many African countries, they're actually closely tracking political campaigns. And somehow politicians have made the conscious choice that the political campaigns are something that is worth undertaking and that they can bear the cost and the risk the risks to society and to their populace, but political campaigns must and they do happen. So we've seen elections in Malawi, we've seen elections in Ivory Coast. Of course, Tanzania is there. We saw elections in Burundi. So COVID has not changed much with regards to politicians' willingness to actually undertake political activity. And then I think something else which is quite interesting is the narrative about personal responsibility, that this narrative has been taken to the next level. And not that I agree with this narrative about personal responsibility, but I think we've had several narratives. It's about you, and it's you, and you don't have to take precautions, and saying you're on your own, and those kinds of statements. We hear them a lot. But this is taking it to a level that perhaps is not very helpful when it comes to something which is a pandemic that affects everyone in the world. So this is where we are, but from my perspective, where should we be? I think we need a little bit more science in the way we make decisions. And science is informing decisions, but I think if you're to do a proportion of how much science goes into decisions, I think it would be a tiny little bit. And then we are getting politics and other considerations that are taking maybe a lion's share of the amount of advice that goes into decisions. So a little bit, not that science should trump everything and not that everything should be based on science, but I think we need a little bit more science because we're making lots of decisions that perhaps are questionable from the science perspective. And then, of course, thinking. Some of us had hoped that COVID-19 but to see our policymakers and our decision makers falling back on the old, tried and tested, old thinking when it comes to the kinds of interventions we should be thinking about. There's been a lot of talk about COVID is not just a health sector issue, but then we still see falling back the same things we've been struggling with to improve health. We're still falling back to the old thinking around the kinds of interventions we're putting in place. And then I think we need to realize that health is not just about hospitals, and that where we should be is to look at COVID as a multi-sectoral issue, and therefore if you want to deal with it, not just think about how to strengthen our hospitals. And since this is a webinar about education, I picked an example from Rwanda, where they're constructing 22,000 classrooms, and that they are near completion. This was sometime in August, probably they are now. And the whole point is that for us to deal with COVID, it's not just that we should make sure that we have ICU beds and oxygen and all that. We need to think about other sectors in society and how they can be enabled to respond to COVID. Structure or the economy, stimulus packages and all that we are going to deal with COVID just by focusing on the health sector. COVID-19 responses, right? And when you go through that article, it's everything. They looked at the school to go to work. They gave them, something to stay so that they can stay at home. They looked at the health sector. Most of these are countries which have universal health coverage, so people don't have to think about bills. So I think it's something that we need to bring back government into COVID-19. Government, there are things government is doing, but I think we need more of that. So over and I forward to the next presentations about
Thank you very much, Dr. Ari, for this very well laid out presentation that actually lays the stage for where we actually want to go. Just to pick up one of the key themes that you spoke about here is how we just should take the health sector alone. Coming from the health sector, it's good and refreshing to hear saying we should also consider our colleagues in education and let them take the lead on this and tell us what we need to do with our education and how we can improve and be ready for it. So thank you very much for that. We will definitely have more to chime in and talk about later after that presentations. But now, allow me to welcome Moses Ngware, who will help us to just set the scene on this education system response to COVID-19 in Sub-Saharan Africa. Moses, the floor is yours.
Thank you very much, James, and thank you very much, Catherine. We'll pick it from where we left. I think you left us with a very strong message about, as I introduced, please, Generica or Maureen, please share the slide. You give us a very strong message about individual responsibility, about the need for the government to come on board, and about the context that each and every country is looking at its context in the decisions that they are making to open the schools or even do other things. So I'll quickly take you or walk you through some of the things that are happening within the education sector, and particularly looking at the operations of the education system. And all of us are aware now in March, April, many countries and education systems closed the schools impromptu, sending more than 297 million children back home. And of course, this included also youth. And immediately what we started seeing was the activation of distance learning solutions, others being innovated and others being expanded. For example, the radio programs, the reach and access, TV, and even internet. And we also know that the in-person instructions by teachers were disrupted widely in almost all the countries in sub-Saharan Africa. But then we also saw that localized teaching initiatives were later initiated as part of the innovations and all the measures that Catherine did mention some of them. We still see the continued increase in the number of cases. And I think the two graphs that Catherine showed at the beginning, comparing Kenya and Burkina Faso, I think, alluded to that. Okay. Next slide, please. Yes. Again, these closures of schools came with some implications. The impromptu closures and pre-existing challenges meant many countries were unprepared to continue with the learning, with the teaching, as well as the children's safety and protection. For example, we find a lot of issues with regards to the marginalized and vulnerable children and youth. How do you reach, for example, girls in marginalized areas? How do you reach children with disability, for example, and you are using a radio, and radio is audio, and probably they have a hearing difficult. Again, those challenges came up strongly in many countries. But then, even with that, you find the countries being able to, again, for example, using a mix of technology to try and close some of those gaps. But then, of course, access to those learning solutions still remains a challenge, as well as the protection of vulnerable girls. I think we've had very many cases in many countries about girls being abused, getting pregnant, and we are going to hear more about that with from one of our presenters. So I'll not go to the details of that. But then after that, we started seeing the new normal narrative coming in board, and people saying, hey, how do we go about it? For how long are we going to remain closed as schools, as the systems? And now that we are being told that COVID-19 is not going away in 2020, although we know that there is a layer of hope given the new development in the area of vaccine. So all these things have created pressure to reopen schools to protect girls and other marginalized children and youth, to continue with the teaching and learning, and more importantly, to think more about the safety of children and other vulnerable groups. So because of this, then we've started seeing the systems have started responding by opening either fully or partially opening. Let's go to the next slide. And in the next slide, we try to see some of the countries that have, either they are still closed, or they have opened partially, or they are fully opened. Now, some of the data here that we highlight in red are very interesting because this is the class size. We do know that among the fears that the schools had at the beginning was schools are overcrowded, classrooms are overcrowded, there is the social distancing. How is this going to work out? But looking at those who have closed, those who are partially open, and those who are fully opened, those worries have disappeared, and later on we shall see how they've been able to cope and to deal with this kind of worries. Look at Liberia, for example, under the partially opened, it's at 127. Probably that's why they are partially open, so that they can learn from what is going on and how they are going to cope with this. But look at Malawi at 90, class sizes at 90. If you have a classroom of less than 100 square meters, and you have almost 100 children inside there, and you are talking about social distancing, exactly that you can, for example, apply in Malawi, apply the same thing in Liberia, apply the same thing in Kenya. I think every country is looking at its environment and trying to analyze what is emerging. Let's move to the next slide, please. Next slide. Okay, here we can see the countries that are in green. These are the ones that are fully opened. The ones in blue, you can see they are partially open, and a few reds that have not opened, like Ethiopia. Of course, Ethiopia has the second largest over 26 million children. It has the second largest population of school of children in primary and secondary school in sub-Saharan Africa, second from Nigeria that has about 7 million. But the point here is we can see the greens are becoming more, meaning many systems are fully opening. Let's move to the next slide, please. Again, funding is important and resources are important because there are new things that have come that the schools were not prepared for. before the closure, and that they will require resources. For example, you need more water points, you need hand washing, you need sanitizing, you need to train the teachers to respond to this. And this is why we start seeing countries starting allocating resources to schools. And this is happening to many countries in sub-Saharan Africa. For example, we were able to identify about 16 or more than 16 schools where funding has been identified. But one key thing is the bilateral and multilateral for financing agencies and the development partners, they've come on board very quickly and they reacted very well, and they have supported most of the schools, so that most of the fundings that we are reporting here, and we can access this information from the internet, is from the bilateral and multilateral resources. But interesting and very encouraging is we do know that even the countries themselves are putting the resources, and we can be able to see the case of Lesotho, for example. The funding that are reported, about 75% are coming from the government. In Kenya, we see about 50%. Some of the areas where the resources that you have seen earlier are being spent. Next slide, please. Again, one of the negative implications released 1 or 2 months ago from the World Bank, and one of the things that have come up is the loss in learning. Now, and we do know that learning outcomes is a measure of education and achievement, okay? So, and what this study and emerging research is trying to tell us is that, hey, the more we continue closing the schools, the more the kids are going to lose the learning that had already been achieved. For example, in sub-Saharan Africa, before the onset of COVID-19, it was anticipated that on average, an average student will acquire 4.7 learning years in school. By learning years or by schooling years, we are trying to combine how long you stay in school vis-a-vis how much you learn. So if you compare the two, you end up with some of the statistics that we are reporting there. But with the onset of COVID and the continuation of closure of schools, this was reducing to 4.3, even when you use very optimistic measures. And that's not a good indication for the education. These are some of the things that are informing the reopening. Next slide, please. For example, out of the 39 countries in sub-Saharan Africa that we looked at, 24 of them have fully reopened, with another 9 being partially opened. Okay. Now, we also know that the first opening is being practiced in some countries, and we do think that because they wanted to learn from the environment. We are also seeing that the drivers of reopening are largely 3. One is children are safer in school than away from school. That is strongly coming out. Also, there are equity and inclusion considerations when you continue closing school and offering teaching through distance solutions, because distance solutions have been known not to reach certain segments of the population. So because of this, I think decisions are being made by many countries to actually either partially open or fully open. Let's move to the next slide, please. So what we have in this table is the key considerations that we see being are being used or being made to reopen the schools. Probably the approaches that are being used here is one is to look at the enabling environment related issues, then look at the adaptation mechanisms, and then have the system thinking. Now, at the enabling environment, what we find the country is doing is to look at COVID-19. Of course, this has to be followed by the resources because some of these changes in programming will require resources. These two are what is providing the enabling environment. But that alone is not going to lead to facilitate the reopening because countries and the systems wanted to adapt. So they go in there, they learn how, for example, to keep the children in school, how many kids can you keep in a class, and then after that, you are able to adapt. If, for example, you have a 15-minute break and you want them to sanitize and wash their hands, and you've provided hand washing points, are the 15 minutes enough given the hand washing points and you have 200 children? Then you learn and you adapt from that. That's the kind of process clearly following the laid down MOH practices. Catherine did say that COVID-19 is a multi-sectoral thing. So even the Ministry of Education have to adapt from what other sectors. You have to plan the school calendar and the curriculum implementation that have already been disrupted. Even as you implement and you adapt, you have to think about, for example, the physical challenge, for example, children in marginalized areas. Let's move to the next slide, please. So this is the final slide, and what is emerging are some of the lessons. The safety of children while away from school, I think it is becoming, it is emerging that this is something that even after the COVID is something that people are learning, that we are going to live with, that whenever children are out of school, there is a much bigger danger than when they get safety in terms of abuse. So the protection or issues of protection becomes very, very important here. Also, anticipated loss in learning is thought to be huge. Research has just started emerging, trying to measure this kind of loss. And given what is already emerging, no one wants to keep children out of school longer than they have already stayed. Also, adaptation seems to be a key operational driver. Every country has got its own unique context. So you try things, you plan, you implement your action, your plan, and then you monitor, see how you're succeeding, you adapt from that. Then countries are opening both partial or full education system, even as the caseload are increasing. But why are they doing this? One is because they now have more confidence. And I think Catherine did allude to that. At earlier on, we used to hear 100 cases and we get scared. Now we have 700 cases or 1,000, not as scared as we used to be. This is because I think most systems are gaining confidence in their planning and adaptation. And finally, implications of not opening are equally becoming real and painful, e.g. violence against girls, and we're going to hear more about that in one of the coming presentations. Let me stop there and thank you very much for listening. Over.
All right. Thank you. Thank you very much, Moses, for the details in the presentation and setting such a wide sort of very global, I would say, picture that is on what's happening in the scene. That helps us with the waiting for Dr. Mona to, I don't know if you can hear me.
Excuse me, I have just a small problem with my connection.
No problem. No problem. No problem.
For now it's okay, but if I have a problem, I will switch to my computer, my phone. So for now it's okay. So can I have my presentation, please, or can I share it, because I sent it to. Can you please just share for me the connection, my presentation? Okay, is it possible to share the first one with my name, just to present myself and my institute? Okay, so my name is Mona Laroussi. I am the director for interim for IFEF. IFEF in French is Institut de la Francophonie pour l'éducation et la formation. It's an institute specialized in education and TVET, and we are present in maybe more than 20 countries in the African and other countries. So the next slide, please. I want to have to thanks for you to give me this opportunity to discuss with you and to participate to this webinar. So my mission was to give you what is the possible scenario in order to integrate or to return to the schools. For that, we propose a possible scenario for that. The first scenario is to make an hybrid or melted schools, and for this method is based on presence in schools. And one scenario applied for a lot of countries is to have one group at school and the other one at home. But for this scenario, the difficulty was how to motivate the school, the student or pupils at home. And there is many ideas about it. I discussed this idea just after these slides. The other one is to put camera in schools, and we have the students or pupils at home can follow with camera, and this problem that is not motivating our generation of schools, the new generation. The other one used by a lot of countries in Africa, and the other one is to use the radio and television, but this is a small problem because in such families there is one radio and one TV, and this radio and TV is generally for the father or the grandfather, and they prefer to use it to follow football match, soccer or other one. And the last one is the use paper as a media for schooling, and the problem of paper is how to distribute the paper and how we can put text and course material in this paper. Next slide, please. This one is to explain you the other scenario based on learning technology, on internet technology. And the first one is to have 20% as face-to-face and 80% at in distance learning. And for this one, in the face-to-face session is to put student in a context and a period following with tutoring at distance. And the other one is face-to-face, is the debriefing session, that 20% done in this part, and the debriefing session at the end of course by presentation, by defense, by evaluation. The second scenario is to put what called the melted courseware, course material done online and with video, with self-assessment, etc. And the other one is when students are present, is to make minute collaborative work as a demo, stress demonstration, what we call in French today, practical courses, etc. The third one is the opposite of the first one, is to have 80% of presence and 20% at home. And we have to present the first one as lecture, practical work, and this is done for studies like mechanic, engineer, or physics, math. And the other one, and 20%, is made on mail, forum, and put our work on cloud to do like this. And the last one is full distance resources and activity course, self-assessment, problem situation, tutoring, evaluation, exchange, and communication. The examples like in the fourth scenario is to work on as we call flipped classroom or reversed classroom, is to give all work to the student of the course, do done by themselves, and to reserve a time to discuss about their knowledge and about their question, their problematic, and their issues. Next slide, please. But in this situation, in the situation that I told about scenario in classrooms and the distance of the teacher role, the role of teacher is will be a major challenge for instruction, is to rethink learning using a constructivist approach. For example, we have to put the accent on collaborative approach, on a dynamic group, on active pedagogy, on interactive learning, etc. Faced with the constructivist pedagogy, some instructors feel that their identity is threatened. They think that their role is not now to teach, but what is the real world, especially when we give the opportunity to pupil and student to search and to find information. The problem is now in situation that we all go, what is really my role? Because this is in the picture, they can find quickly the information on Wikipedia or in other work, and what is the real role of the teacher in this situation. And I think that the teacher have to change to be a coach and to be a link between knowledge and how to make this knowledge concrete and really for the student or your people. The other one is without training, and this is the situation in many countries. Many teachers tries to replicate exactly the same thing in the course in a presential way. So they practice the same way as the face-to-face and not to hybrid or melted online teaching. Next slide, please. So I have, I'm from Francophonie, so excuse me, the slides was in French, especially for this one. It must be taught beforehand to be independent, to be autonomous. When we prepare our course on distance learning, especially with radio, television, or other way, we have the lack of feedback. We cannot look at our students and see their reaction face to our presentation. So we have to forecast all this information or feedback and anticipate and to give to all question of students and especially all profile, because there is heterogeneous way and we cannot give the course at the same way at distance, because they have an input to give and other information needed more than the course material. And especially we have to focus on formative evaluation just after giving the course. You have also used the simplest and most free digital tools for giving information to students, like a paddle, like information simple to use for students and for parents also. And we have a big problem. They are dropping out. Students cannot follow up information at a distance in the same manner that they were in presence. We have to plan very good student work in order to give them courses in all periods that they are not in class. And if it's possible, it's not usually possible, make a virtual classroom with all people and give them the possibility to speak and to discuss, all of them, not just one or two. Next slide, please. The point to enter students, what is changed is pedagogical practice. Do teachers need to make when moving from face-to-face to hybrid or online teaching? How do instructor perception change over time when moving from face-to-face to hybrid and to online teaching? And what influences change when the instructor moves from face-to-face to hybrid and online mode to instruction? The next slide, please, is the factor driving the decision to reopen or to remain closed. It's from a point of view, I'm in Senegal, and just to give my point of view about this factor. In giving possibility to reopen the class, we give equal opportunity to all of students. So students having computers, having internet connection, or having a smartphone, and the other who hasn't, to all of that. Schools permit or let sociabilization or socialization with other students, and also all collaborative work, cooperative work, and also working with a group and not just alone, even if there is tools letting to do that at distance, but it is not like working together, discussing, and not to be agree with something, giving all argument about. This work also for family working in distance and teleworking is relieving to these families, because mother or father working in distance with students, it was a very psychological way of life and very huge. And other one, and especially in Africa, there is a big problem of dropout because many students don't returning to schools yet. And otherwise, with dropout problem, there is an early marriage of girls that they left schools. For not, argument for not, there is a problem of contamination between child and parent and child, etc. We put teacher at risk with returning and opening schools, and education staff are not trained for this situation in the case of disease or of contamination, massive contamination at schools. Thank you for I'm sorry for my problem of connection and my English, and I am able to answer to some question if it is necessary.
Absolutely, Mona. That was wonderful and wonderfully said and wonderfully done. We appreciate your time and your thoughts bringing this. Definitely, we'll have questions for you at the tail end of these presentations. Thank you very much for that. For now, I'd like to welcome Dr. Tilai, who's going to talk to us about solutions and innovations that are being used to promote the continuation of learning among all learners during emergencies and pandemics, such as COVID-19, with particular focus on learners who are at risk of not accessing learning. Dr. Tilai, welcome.
Thank you very much, James. Thank you. As you said, first of all, I would like to thank you all to give me the opportunity to present some of my thoughts on this very important gathering. So, as you can see, my topic is this one. It was given to me by the coordinators, and I could not conduct comprehensive research on it because the time given is very short, but I used my advantage of being the consortium manager at Kicks Hub in Africa 19. So I tried to capture points from here and there, and then brought you some points for discussion. So can you move to next slide, please? Well, in the first slide, I would like to give you just a bit of background to have a sense of understanding about the effect of COVID, particularly on SDG. I tried to consult materials written by IMF, World Bank, UNESCO, and others. So from this, I got the point that COVID has triggered an onslaught of bad news for global sustainable development in terms of the following. First, the deepest global recession in memory is happening now. The GDP declined for about 5.4%, and the broadest decline since 1870s. And more than 90% of all countries are in recession now. Approximately 140 million people are living with extreme poverty, and potentially 130 million people are leading their lives with acute food insecurity problem. There are also broader social disruptions which are taking place. As many as 1.2 million additional children are expected to die in 6 months as of September due to healthcare disruptions. About 1.6 billion children and youth are having been affected in their schooling. And about 400 million jobs are lost due to this COVID. Next, please. There are also collapses occurring in areas of cross-border tourism. About 65% of decline is occurring due to this in the first half of 2020. Trade has been declined for by about 15% during the first half of 2020. Remittance, which are supporting countries, especially in hard currencies, are being reduced by about 7% this year. And foreign investments into particularly in developing countries, especially in Africa, are being reduced as much as 45%. Next slide. When it comes to the schooling or learning, the effect of COVID is very huge. COVID crisis has resulted in massive closure of schools, polytechnics, and universities. As our earlier presenters mentioned it affected about 1.6 billion learners across the world. When it comes to Africa, about 297 million learners have been affected by it. School closures widen education inequalities and affect vulnerable children and youth disproportionately. There are also studies which indicate that learning poverty is increased by about 10% than where it was prior to COVID introduction. That was corroborated by World Bank as well as UNESCO Institute of Statistics. Before the emergence of COVID, the learning poverty was taking place at 53%, but after the introduction of the same age group, learning poverty was found to increase by about 10% of what it was before its introduction. So families, communities, and school leaders across the world have been struggling in trying to ensure the learning gaps which have been created as a result of this. Next, please. Well, having seen these very vivid problems, international actors, particularly governments, practitioners, policymakers, as well as parents have been struggling to live with COVID. And we can see the reactions and the response of different actors in two phases. One is during lockdown, and the second one is during opening of school, reopening of the school. Some of the innovative responses that were applied during lockdowns were, well, ICT has been used as a reliable instrument in promoting learning, ensuring sustainability of learning across the world. By using this ICT, countries have tried to introduce radio lessons, television lessons, particularly in broadcasting some core subjects like mathematics, science, English, and others. In this case, up to 2 to 4 hours were slotted on national radio as well as televisions, depending on the country's program. Some effective teachers were recruited and trained and they were assigned to provide online trainings, online radio lessons and TV lessons. Lessons were recorded by different professional groups in order to ensure the quality of the documents, and lessons quality were assured by different actors like inspectors and resourceful teachers, and governments tried to negotiate with telecom companies in order to provide free access, if possible free access, otherwise with minimum cost for providing online courses, radio as well as television courses. On top of this, self-learning interactive materials and simplified materials have been uploaded into the websites of the ministries so that students and parents get access to them. And parents were encouraged, highly encouraged, to support their students at home, especially in doing some exercises, clarifying some concepts, and that is limited to those who are literate and capable parents. But those who are not fortunate to have this kind of parents are suffering. Tertiary institutions were switched to online modalities in different countries. Next. Well, these were the actions taken by countries during the lockdown stage, but during this lockdown stage, some challenges were confronting the education delivery. One of which is high learning gap created between rural and urban, poor and rich families due to technological divide, as you know. In order to get access to the right educational technology, such as radio, television, telephone, internet, which is in many cases very scarce in Africa. Children from less educated or illiterate families suffered from learning crisis as they could not get the necessary support from them. These problems continued unabated in many African countries up until now. Although different modalities, different supports are provided by countries and partners, these crises are still largely existing. Next. There are innovative responses for during school reopening as well. Well, during school reopening, some of innovative actions taken by governments are the following. One, there were plans put in place to open schools. Some multi-sectoral approaches were strengthened, like Ministry of Education working with Ministry of Health and National Defense Forces or Police Forces in order to ensure students are getting to school safely. Safety rules and guides have been developed based on the WHO standards, as well as some developed country standards like CDC of USA and others, European Union. And task forces have been established at school level to closely monitor the developments and detect any problems, some infections or other problems related to students learning in school while they are in school. Student transport buses have been arranged in some countries like Rwanda so as to encourage parents and students to go to school, to get back to school. And school disinfections have been carried out on periodic basis in order to clean some contamination in school. Personal protective equipments like masks, sanitizers, water and detergents are being arranged by schools, sometimes in collaboration with partners, development partners. For example, in Ethiopia, 2 washable, reusable. There are also free both primary and secondary schools so that the students get the necessary dietary support. There are also massive construction projects executed and class size reduced considerably, because in some of the countries like Ethiopia, in before introduction of the onset of COVID, in a class there were about 70 to 100 students, but after COVID, the standard has been set to reduce this one to 30 students only. This definitely requires some school buildings expansion. Some are done and some are not done, but as a result of which there are some critical challenges facing students in schools. Next. ICT used for facilitating learning still. Countries, in this case, in order to promote the usage of ICT and to make it a culture, some countries are establishing partnerships with IT suppliers, like Kenya has established partnership with Microsoft to provide some inputs. Some West African countries have established partnerships with Huawei to provide some internet and other facility gadgets. And there are also some countries which are working with Amazon in order to produce some storage of materials. So partnerships are being increasingly demanded on the part of the countries to facilitate learning. And there are also shifts, particularly in Ethiopia. There are up to 3 shifts introduced in the country by compressing learning time and revising the curriculum. In this case, class size, which were ranging from 70 to 100, were reduced to 30 only as per the standard. There are also supports provided to children, psychosocial support and child protections provided. And there are rigorous campaigns which are going on in order to influence parents to send their children back to school. There are also some initiatives which are taking place in some countries to assess the learning gaps which are being created as a result of lockdown and returning back to school. Some countries are implementing accelerated learning programs in order to facilitate closing of learning gaps in schools. There are also efforts to monitor re-enrollment to identify and support children that are dropping out, particularly girls, due to different social problems like pregnancy, harassment, fear of some kind of gang, and this kind of things. There are also regular monitoring and evaluation of COVID and overall responses, schools and institutions of higher learning institutes. Next, please. So this is my last slide. Well, after observing some attempts, some innovative practice of countries and different actors, there are still some challenges hanging and some recommendations as well. For instance, as a result of COVID, there is a reduced academic year calendar which is taking place in the form of shift introduction. So this is done because there has to be a transition of students from one place to another. But in order to compensate this, countries are expected to implement accelerated learning programs or interventions. There are limited radio and television coverage and lack of utilities like power, water, and internet facilities in rural African countries. In that case, some measures have to be taken, like distributing self-learning materials is very important. Introducing alternative sources of power like solar panel is very important. Pilot use of some technology gadgets like tablets is very important. And to facilitate this, collaboration with IT suppliers, technology suppliers is very important. And the other is there is massive all-round financial constraint, particularly in African countries. That is a very huge problem. In order to supply safety and hygiene materials to students, to construct school buildings in order to live up to the expectation of students, because as a result of introduction of shift system, the schools are being suffering from different resource shortages. For example, prior to COVID introduction, the one bench was used for 3 students, but after this one, after introduction, after COVID, one bench is used for 1 student. And there is a serious shortage of chairs and benches, and as a result, many students are learning by sitting on sometimes stones without tables. So these problems are occurring. So in this case, there has to be intensification of support within the country as well as development partners. And there has to be rigorous sensitization of parents and communities about COVID-19 so that they live with it and try to support schools closely instead of remaining shy of it. So teachers' reluctance and or fear to partake in the interventions is also one serious thing. So in this case, there has to be a motivation mechanism, a collaborative effort, participatory approach to encourage teachers to be part of the system in proper way. And there has to be some effort to encourage school community to live with COVID, as it is the case with HIV. So these are all of what I can say here. There are many things. I have collected different data, but I could not present. Thank you so much.
All right. Thank you, Dr. Hitler, for your presentation and the opportunities of what we need to see. I'd like just to bring a bit of comments before I bring in my next speaker. Abdikadir, who's commenting on our chat, saying learning poverty stood at close to 75% before the pandemic. there is a very high probability that these percentages will increase. Dr. Woon Hussein, also on our chat, says great and informative presentations. Please share with us the slides there on email. Flora Karimi comments that considering the fact that there has been huge learning losses, what should be done to catch up as schools reopen? There are mechanisms in place for the same. I believe we will be able to answer these questions as these presentations go on. There's many questions that are being answered, and we would like to continue answering these questions. So please feel free and continue bringing us these questions on chat. For now, though, allow me to bring in my next speaker, Dr. Benta Abuya. She's going to speak to us about a coordinated response to ensure education innovation during and in the post-COVID-19 world addresses inequality among the poor, particularly among children. Dr. Abuya, karibu sana.
Thank you very much, James. And thank you everyone for being part of this presentation and being part of this panel. I'm going to talk about why we need to address inequality, why COVID-19 is exacerbating inequality in learning among children, and particularly girls and those who are marginalized. Maureen, I believe you're sharing. This is just an outline, so I think we can move beyond that to the next one. And so when we talk about children who are marginalized, and having listened to the presentations before, we realize that children who are marginalized are at the core of the SDG 4. In fact, if we don't deal with children who are marginalized, girls, be it children amongst pastoralists, the communities in Africa, be it children amongst nomadic pastoralists, be it children with disability, then we may not actually hit the focus of SDG 4. And the main idea there is that we do not leave any child behind, and that we also have to look at issues of gender equity. And most importantly, that education should be equitable and inclusive, and commitment to that lifelong learning. And I think when you look at the diagram to the left of that, we see why equity is actually a prerequisite for getting to the normality of what we call equality. Because there is this child who will need much more than just having the books and the pen in the class. And that child, even in a COVID world, will need much more than just having the online learning prospect, but that child will need more support in a post-COVID world so that they stay focused on learning and they are not left behind. And therefore, it's incumbent on us as practitioners and as education practitioners and ministries of education and countries to be able to continuously look at education as a public good, that every child deserves that education and that it's a human right. And that as we work on the evidence and we broker our knowledge, then we need to think about that child who is not the normal child, but the child who needs extra support, even in a pandemic world like we are living in. Next slide. So addressing inequality remains necessary, and I'll not go into the data because I think a lot of data has been gotten out there. But my emphasis here is that our marginalized learners will need more support to continue learning. During post-COVID, it's going to be even more necessary to be able to support such learners, because if we don't do that, then we will exacerbate the exclusion of many learners. And particularly, I know what we don't want to do is that we don't want to add to the millions of children who even before COVID were out of school. I say that because some of those children who are out of school, and particularly girls, may not make it back to school if we don't do things differently. And when we look at our inner cities across Africa and our urban informal settlements and children who are receiving education in an urban context, in most cities in Africa, and particularly if I use the example of Nairobi, those learners were the most hit, particularly because for instance, in Kenya, about 0.2 million of some of those children were learning in schools that we call low-cost formal schools. And we hear in the news every other time that some of those schools have actually closed down and they may never reopen. Next slide. So we've heard a lot about loss of learning time because of lockdown. And this loss of learning time has affected more the children who are marginalized, and particularly girls. And why is that so? It's because, you know, girls and children who are poor and children who are those within the nomadic pastoralists are children who before COVID have actually gotten the short end of the stick. But most importantly, we see the psychological impact of COVID on some of these children. And when we come closer home, talk about girls, we see domestic violence, but we also see a lot of teenage pregnancies that have also come up as a result of the confinement and the thought that children are not even able to move out of their households. And in some cases, we've also witnessed elements of cyberbullying. But has also been mentioned by one of the other presenters. You know, when such children attend schools, particularly from poor communities and marginalized communities, schools have always provided the additional support in terms of food. So what does that mean? There has been food insecurity in households across children who are learning in cities in Africa and those who are within the urban informal settlements in Africa, and even those within the rural areas, because they are no longer attending school and so they cannot benefit from school feeding programs. Closer home, a case of Kenya, I would also want to say that COVID has widened the gap between the well-endowed private schools. So we have well-endowed private schools, but we also have low-cost private schools that we call the alternative provision for basic education and training, and of course our public schools. Why is it so? It's because in well-endowed schools, online learning started almost immediately. But in low-cost private schools like those in our urban informal settlements across cities in Africa, you will find that some of those children were the first to go home, but they were also the last perhaps to be brought back through some online system, if at all they were brought back. And in some of our public schools, because governments take time to be able to initiate some of these programs, even in as much as they may have been initiated in some countries, we see that a lot of the public school systems are still left behind in terms of even access to the innovative solutions. And I think Dr. Kasahun has alluded to that as well. And so when we are thinking about how marginalized children should actually benefit in a post-COVID world, then we need actually to think more so, and one of the speakers has already talked about a multi-sectoral approach. But I think I would be able to say, beyond the multi-sectoral approach is to have a sensitive way in which governments begin to look at some of these learners, perhaps who are in our public school systems and those who are in low-cost private schools across Africa. Next slide, please. This is just to show some of the innovations that have been there, and I don't want to belabor the point. This point has been driven home, so we can go to the next. So when I look at the glimpse of sub-Saharan Africa, the radio has been used, it has been talked about, but about half of the countries have also used internet-based approaches. The question I kept asking myself, what happens to the other half? But also what happens to the other half that perhaps also has the marginalized children? So if they do not have some of these approaches, then what happens to these girls? What happens to children with disability? Yes, we talk about text messages have been zero-rated across countries in Africa, that students can be able to ask questions. To what extent is this replicated across different communities and different learning stakeholders? And of course, we know, as has been said, that these approaches will depend on electronic gadgets, the sources of power, the internet connectivity. Just to give an example that if you look at the differences between urban and rural, the urban might have an advantage, but even so, you will find that most urban centers in Africa, up to about 35% would be connected, and perhaps only about 7% of the rural areas will be connected to any internet connection. Now, that still advantages only a few, but also makes our children who are living within the margins suffer most, because they will be the ones forgotten and thought about last. Next, please. So in East Africa, we know our East African countries. I just want to look at the second point and say only 3 of our countries in East Africa, closer home, were included in internet-based option. That is Kenya, Rwanda, and Uganda. So what about the rest? And then what happens then to those children in those other countries? But even as I've said, even in and urban settings were connected to the internet as compared to 7%. What does that mean? It means that still we have those who will be living within the margins and not being able to access learning. Next slide. So why online channels may not necessarily eliminate inequality? I know that is what is preferred now. I know that governments are trying very much. But one thing that we need to be aware of, particularly with the lens of a marginalized child, that online channels cannot replicate an in-person classroom teacher support. So I think that the hybrid nature, as was advanced by Mona, maybe might come close to addressing this. But even the way we bring in the hybrid element might also be thought about critically, because then that learner who has been out of school and needs to come into school, what do we do? And that learner who has a physical or even hearing impairment, how do we get the two to work together? But most importantly, what I have been able to see across many programs that have been implemented, especially among children who are marginalized, is that parents, yes, are supposed to support learning, but parents in most communities are not empowered to support their children's learning. And in one study to support their children with learning, then they would be in a better position to do that. And in one study that was done this year, the parental awareness of even that there was online learning available for their children was ranging between 97 and about 18% from an urban center to far-flung areas of northeastern Kenya in Mandera. And that meant that about 80% of those children, even though those innovative approaches were instituted in many countries, including Kenya, that 80% of those children were still missing out on some form of online or virtual learning, partly because of gadgets or internet, partly because of connectivity, has already been said a lot, but partly also because of capacity of teachers in driving those online lessons. And one interesting thing is that when pandemics happen, we seldom don't remember the very people who are at the front line of our education systems. I know, and I agree with Catherine when she said that, you know, it's not a health solution only, but we also see that even the health sector has also been challenged because governments also forget the frontline people who work in the health sector. It's the same way that the teachers are thought about last, when they should be thought about first, so that they can be able to get more interactive with some of these online classes. And particularly girls are at the margins and will be further left behind. And I think the gains that we did have with the MDGs, now the SDGs, we will be almost 10, 15 years backwards, simply because, you know, girls have another hoop to jump in terms of COVID-19. So on top of what they've always had, like teenage pregnancies, like problems of transactional sexual relationships, problems like child-headed households, problems like early marriage, and even problems of violence against them, either at home or school, now they are faced with disparities in terms of how do they access learning, but more so because in a COVID world, everybody is trying to survive. And sometimes, in most cases, the burden is left to the girls, as the parents are also struggling, perhaps with job losses, perhaps with looking for extra income. And so we really need, this is a group of people that we really need to think about very critically as we go into a post-COVID environment. Go to the next. So here I want to talk about some approaches that are similarly working, and I'm coming closer home to East Africa. And those approaches, I'm going to look at some of the case studies of approaches that are working in one initiative that is being rolled out in East Africa called the Regional Education Learning Initiative. And the RELI initiative is a member-driven initiative working to ensure inclusive learning for children in East Africa, and really envisions an East Africa where all children receive quality education regardless of race, color, creed, or ability. And so the pillars of RELI, that's why we think this is something that we can also learn from, is that we RELI actually thinks about transformed organizations on how we can program, but also thinks about co-creating evidence, and also thinks about policy influence. Now, getting back to our marginalized children in the post-COVID world, through conversations in this initiative in East Africa, for instance, we have been able to see closer connections between policy and stakeholder engagement. And it means that even in those areas where we have not been able to understand nuances of equity and inclusion strategy and how to build an education, I think it's now incumbent, and with these conversations, it's incumbent that initiatives such as this we can be able to learn from them, so that closer connections and those closer conversations, so that both governments and those who are practicing in terms of the approaches, that the education approaches, can be able to talk same language. In our talking to some of our policymakers and some of our stakeholders, you will realize that even before COVID, the understanding of what equity and inclusion meant, and the understanding of how to treat children with disability, and how to understand what girls in a pastoralist community would want, and to understand why particular children who are left behind should be brought into the main arena, there's always been a disconnect. And I think that the collective understanding of the issues of equity, inclusion, and equality in a post-COVID world will then reinforce the support from policymakers, so that even as we talk about more government support, that we need a government that will be able actually to understand who is this who is marginalized, but how can I reinforce that support? And some of those conversations we think are something to learn from. And I think it's important now and going forward, because we will, if we don't have these conversations to understand how to bring our marginalized communities back into the fold, then we will have populations and situations that are more marginalized, and we will have a vast majority who will not be able to access school. As I gave the example that in some of our inner cities and urban informal settlements, we may not have those children join school, because one of the reasons may be that their school that was there, which was a low cost, is no longer there. So where does that child go? And yet, in a public school that is nearby, is overpopulated. So is that child accepted there? Perhaps not. And so what happens to that child in an environment where the parent is also struggling? Next slide, please. So in our neighboring Tanzania, which is a part of the Regional Education Learning Initiative, there is a promising approach by Shule Direct. That promising approach is called the school that never left. So even as schools closed, the online interactive platform that Shule Direct initiated connected learners, teachers, and parents. And I think this is something we can learn from and build on. And learners can be able to take online classes in secondary school. They can be able to self-assess. They can be able to interact with a virtual teacher, but they can also be able to share their experiences with their parents. Now, this is something to learn from in situations where we may not be able to open some of our schools, and perhaps we may take longer. Because at least when you can interact and the parent is on board, then in that way we have elements of parental involvement, but we also have a teacher who is online, and we also have children being empowered to be able to take their classes, but also self-assess. And the teachers help to co-create digital content. So they have digital content which they can share to the children, and of course then liaise with the parents. So one interesting thing about the school that never left is that students have the opportunity to be able to learn at their own pace, and they can meet their learning needs, and they overcome their gender despite their geographical location, despite their disability, cultural or income challenges. And I think in a post-COVID world, we may want to explore some of those ideas in order to help some of our learners who are left behind. Next slide. Across in Uganda, there is education and entertainment content that is localized, that uses engaging video and animation, that also puts children at the core of that experience, that is designed with children in mind after extensive research. And I think this is one way. We have mentioned innovative approaches, but I think in some of our innovative approaches, we have also not brought the user on board. Because this child coming out of a COVID environment, having mental problems, having been malnutrition, for instance, having gone through a lot of processes during lockdown, how do we make that content more interesting to the child? How do we enable the child to be the end user, yes, but also the developer and the consumer, so that they can be able to get an education that is something that they can also think about, but also can be interesting, and perhaps then attract them as they come back into our school systems. Next, please. And then closer home, we know that our Kenya Institute of Curriculum Development has been using a radio channel. Radio has been used across Africa with running programs from ECD to secondary school. Again, some questions remain here in terms of how far can the radio go, in terms of does every household have a radio? But it's also about do the children remember the time to be able to come back and listen, but are the parents also available in terms of coming in to listen? So these are also good approaches, promising approaches, but also can be better improved to make it work best for our children who are at the margins. An organization also is using train several fellows, and these fellows are used to develop materials that are shared via WhatsApp. And WhatsApp has also been one of those avenues that has also now been developed and has become very important in terms of sharing content across schools and across children. Next one. And as a foundation, utilizes individual interactive study content via SMS. Again, curriculum covers primary and secondary schools. They have partnered with Safaricom as a mobile service provider in Kenya so that they can have free access to platforms, but they can also have data bundles for their teachers and for the pupils. And they also have a service they are calling the Ask Teacher service. This Ask a Teacher service enables students to submit questions and receive SMS responses from instructors. This again is something that can be explored in areas, particularly because it's been used in East Africa, in one of the countries in East Africa, but it's something that can also be explored beyond post-COVID, so that we try to look and have targeted interventions in areas which were most hit, and in areas where children were not able to get to the general online, the general radio, and the general internet connections. Next, please. And finally, closer home, we think that supporting learning using community resources is going to be very important in a post-COVID world. Why? Because these children have to build resilience and have to build capacity to be able to get back into school. I know parents out there are worrying how a child will walk into school after a year or 8 months of not being in school, and that child has been walking around, and perhaps a child has also developed other issues and within their households or within their communities. And closer home, APHRC, for instance, has been working with community-based organizations to be able to roll out soft skills for adolescents and parental counseling, so that we can be able to build resilience among our adolescents in this time when they're at home, so that we can prepare them best to be able to access school when schools open. But also the element of parental empowerment, which has been an issue throughout education systems since the lockdown, is also to work with the parents to enable them to get involved in their children's lives and education as a key resource during COVID-19. But the parental empowerment will also be very crucial in a post-COVID world, where children, particularly those who have been at home, the girls, particularly the pastoralist communities, the nomadic pastoralists, those children with disability will really need the support of the parents going forward in beyond the time of COVID. Next. So in my view, the school reopening, what we need to keep in mind, and I say what to keep in mind because some of this also has been talked about. It will depend, a school reopening will actually depend on how we blend the online and the face-to-face interaction where possible. Because if we keep to the online learning only, then we will continue to marginalize our marginalized children already. But if we also have a face-to-face, then of course we will exacerbate health issues in schools. So how do we blend both methods? And how do we learn from what is working in some of the programs that are being implemented in some parts of Africa? This one, and has been mentioned also before, reopening of school will also depend how we critically think about how we accelerate learning to cover for lost time. I know that Mona talked about the shifts, and also Tilahun alluded to that. But I think that for children who are marginalized is to think of interventions that will bring them aboard in a way that we do not only emphasize the content that was lost, but how do we also make that content become content that can be consumed within the short period of time that it needs to be consumed. My third reflection is on high enrollment. And on this one, I'm thinking that we would need to think about how to navigate the COVID-19 period while ensuring safety. And here I'm thinking about public schools. How do we manage the high enrollment in public schools? Giving Kenya as an example, in most of our public schools, we have between maybe 50 to 100 children, depending on which school you're talking about. So how do we get down to 30 children? And as we get down to 30 children, where will these other children go to? Particularly because, as I'd said before, in some of the public schools, the infrastructure may not be there. Perhaps in some countries, we've not started building those schools. And perhaps in other countries, the low-cost private schools that normally would be able to sustain children coming from public schools are no longer there. But most importantly, in a post-COVID world, and when we think about school reopening, how do we harness the power of community and parents as potential solutions to keep children learning? So that even if we are not able to get all the children in a classroom, how do we enhance the power of communities? I know countries have started doing this, and certain countries have also started thinking about parental empowerment programs, but how do we harness the power of community resources so that children can learn inside and outside of the classroom? Goes back to that blending of the face-to-face and the online. But coming closer home and taking an example from the Kenyan environment, it will become very important, particularly to work with private schools, those high-end private schools, and to work with those schools we are calling alternative provision of basic education and training in a post-COVID world. Because we know that the UPED schools, as they are called in short, have the potential of having a vast majority of children get some learning, particularly those who are living within the margins and those who in poor communities. But if some of those schools will no longer exist because some of them depended on children being there and parents paying school fees, and now they're no longer there. If you listen to the news, particularly in Kenya, you'll realize that a lot of those entrepreneurs actually turned their schools into other things. Some turned them into hotels, others turned them into chicken rearing places because they waited too long. COVID has been around for too long. But what happens to some of those children who are in those schools, and how do we bring them back onto the learning platform without necessarily losing them and calling them out of school children? And I think some of these reflections will be very important as we look into a post-COVID world, because it's not only thinking about one sector, because we might say, yes, we might open schools, this class and that class and that class, but eventually we will get all the children in school. So if we don't do a reflection on all this, then I think we will have our children still living in worse margins than they were living in before COVID, and particularly thinking about those children in urban informal settlements across sub-Saharan Africa. Thank you very much for listening to me.
Thank you, Benta, for that very comprehensive proposals and thoughts that really does a great job on how to just help all of us to collect our thoughts and move this country forward to where now we should, which is the questions we've been asking. I've been trying to look at all the questions that you've been asking, and there are many, and they're all important. What we're trying to do is, I've seen a lot of comments of those asking these PowerPoints to be shared. That can be done so, but I think towards the comments, I want to start where we should, and the most important place is this question posed to that. The question goes like this: how do we bridge the gap between the learning at private and public schools, where private schools continue with online learning, but public schools only go back when face-to-face learning commences? That's questions from Wangombe. And I'd like to start with Dr. Moses. How do you bridge this gap first, before I go to anyone else?
Thank you, James, and thank you, Wangombe, for asking a very valid question about how do we bridge the gap between the private and public schools given the different modes of instructional delivery. I don't have a straight answer, but my response would be, first, those gaps existed even before COVID-19 came about. What has happened is, what we are seeing is not necessarily the school, but the way the society is structured in terms of the social classes. So the working class, the middle class and above, they take their children to private schools so they can afford, they can make arrangements with the teachers to keep the teachers on pay, for example, if they can provide certain services like online learning using Zoom and Google Classroom. So what we are seeing is a reflection of how our society is structured, and it still existed even before COVID-19. But I agree with Wangombe that we cannot sit back and allow that to continue. And one way is to actually do more investment in the public schools. The last presenter, Dr. Benta Abuya, did mention certain innovations, ENESA, Ubongo, Shule Direct, innovations that are in place that could actually be scaled up, but at the national level, their positive impact could be scaled up at the national level. But for that to happen, we still need other investments in other areas. For example, we're talking about access to internet. We are talking about access to internet infrastructure. You bring in the private sector investment and working together in a multi-sectoral approach, we are likely to start moving closer to closing those gaps, but it's not something that we can be able to close, for example, as a country, as Africa, within the next 1 year. But I think a long journey starts with the first step, and I think that's the direction that we should take.
Right. Let me just bring in, let me bring in Mona as well, just to chime in on pretty much the same question, and just to delve a bit deeper. That's what COVID has done in many instances, while for the rest of society, as Dr. Moses clearly says, when one society, the middle class were able to continue with classes and education, so that was very little interrupted. It sort of widened the gap in a way that, perhaps interventions are needed now more than before to bridge this gap for the learners who are, their learning stopped when, the physical presence of teachers actually stopped and, the lockdowns happened. Mona, please.
Just to excuse me, a problem with my connection, or between students continuing their scholarity and the others, which is the kind of gap, or both, maybe the both?
Yes, precisely.
Okay, the gap is very important because this is with what we said in technology, numerical gap, digital gap, because there is with rich family, with access, with tablet, because tablet was told before with a good internet connection. All of these people have the possibility to access to course material, either done by their teacher or not, because there is many course in YouTube, in other and Khan Academy. They can access to all this course, to this video explaining concept or explaining course. And the other is contenting by playing football or not be at school alone. And it's very difficult after 6 months of interruption to be in classes. So this is the first gap, and I think this the other gaps, and it was mentioned by the other colleagues. It's institutional gaps between countries who's introduce digital learning or distance learning in their strategy, and other would discover at the moment of COVID that we can teach with other ways that coming in presence at school. So COVID, maybe it was a very bad situation, but there is we can just call that there is one advantage that introduce numeric digital learning, and with resources, with what we call open education resources and open education in schools. And I think that is at least one advantage with COVID.
Okay, thank you very much. And I'd like to keep this trend as we go for this advantage bit, or at least the positives. Dr. Catherine, in your presentation, you spoke about Rwanda, for instance, as an example, building schools during this time of lockdown, and during this time, when COVID was hitting. I wonder, from your perspective and from where you sit, what do you think sort of governments can do, or some practical steps to say that institutions can do to sort of bridge this gap, like what Rwanda has done, for instance, to sort of either get more teachers in school, build more, facilities. What are sort of more practical steps that you see from where you sit, Dr. Catherine, in how we can sort of start bridging this gap in a more positive way?
Okay, I think it's the occasion also to be together and to make a regional dispositive, a regional framework, and a regional access to the resource together, and to be more strength when we are together in regional way. And I think that is that COVID offers us this possibility, and we have to catch it.
Thank you, Mona. Dr. Catherine, please.
Yes, I think I've been listening to Bent, and I'm marveling at the number of innovations that are already there. That just need to be picked, repackaged, adapted, and rolled out. The classroom that never left is one of those things. So I think there are already a lot of solutions that exist. But at the bare minimum, I think from a public health perspective and epidemiological perspective, I think it's irresponsible for governments to say, COVID happened 8 months later, we have not changed anything in the education infrastructure, and we are still going to send pupils to school. I think it's irresponsible. So the reason Rwanda is building classes is because social distancing is still necessary. You need ventilation, you need all the stuff. 100 children in one class, I don't know how many meters by how many meters, is completely irresponsible. So governments can start setting up maybe temporary classrooms we can change the school calendar. In Burkina Faso, during the rainy season, nobody goes to school. So if you put up tents, you can say we are closing school during the rainy season because it will rain on the kids to do that. So that's what I'm saying. Like, we need to get out of this mindset of business as usual and start thinking about practical things that are going to make it safer for kids to go back to school, but in a way that is safe and responsible. Other things, I've seen some of the innovations from Raleigh. It's because I'm familiar with the project, and there was another report where, for instance, there's a group that is organizing TV viewings in villages. So you get a DSTV, you get a community hall. Okay, maybe now that's not good. Get a tree and put a TV there and let the kids from the village come and social distance and watch this stuff. So the government has responsibilities, when it comes to internet infrastructure, TV infrastructure, but also to make the existing infrastructure safer, whether it is connecting pipes for water and all those things. So the baseline is there, but I don't think it's adequate for the safe opening of schools.
Thank you very much for your thought. I'd like to move to the question from Abdi Kader, who's asked, and I'm looking at the time, that do we have data on the ability and confidence of teachers in using hybrid models effectively? And he puts an example, do our teachers training institutions in South Sudan, for instance, use ICT? Trainee teachers undertaking courses in online facilitation. What is your take on the need for customized homeschooling? I'd like Dr. Kasahun to lead us on this, on the questions of data and the effectiveness of using these models.
Yeah, thank you so much. I can see the concern of the person who raised this question. Well, as you know, in the teaching learning process, maybe the lion's share of the learning gain goes to teachers' capacity and competence to teach students. And in this case, I think investing on teachers will have a huge implication on the learning gain of students. So in this case, as circumstance demand now, teachers may not be expected to teach as usual by using traditional face-to-face modality, but they need to be acquainted with different technological inputs and outputs. So in this case, I think orienting teachers rigorously and developing their competence on usage of different ICT gadgets and technology outputs is very, very crucial. But the thing is, when it comes to teachers are dispersed across the country, all the way from capital city to that of very remote area, in which case, although there are students there who are demanding this kind of delivery, but the kind of acquaintance teachers have maybe in remote areas, in rural areas, is very low, as far as I know. Because I was teacher some time back, and I'm still a teacher at university. So I know this is the challenge we have as a teacher. So I think countries need to focus on, depending on the current circumstance, investing on teachers to improve the quality of education and to boost learning gain or learning outcome. Therefore, one of the need of the hour is what? Introducing ICT-based education system to teachers, maybe in the form of in-service training or pre-service training before graduation. Even there has to be proper coaching and mentoring. That kind of modality can boost the competence of teachers, and then that will be seen as an implication on the students' learning. That's what I have. Thank you.
Thank you so much for your thoughts. I'd like to bring in Benta, Dr. Benta, for just the same, and just to add on sort of that comment. You spoke about innovation. Can we use radio and TV learning as a way of running basic teaching, and the quality of this? Both answer the same question: the quality. What does it do to the quality from experience, if you can?
you very much for that question. Radio and TV for learning, yes. And during COVID, that has been like the default for countries that could do that. The radio was widespread because it's almost in every household across many countries. TVs also are quite spread out. But now when you look at the issues of quality, that's where I would bring the aspect of where is the teacher? Because, or the person who is supposed to facilitate that online class, or the person who was supposed to co-create the content that is going online. Again, online teaching is not necessarily, digital learning is not necessarily picking content from a book and going to project it online. It has to be done in such a way that the child is able to get used to it, but also to go along with the teacher. And so I know there are quality issues when it comes to radio and TV because everybody latched onto that. But I believe not many countries thought about the quality of learning. And again, going back to what Moses said, countries have been grappling. We've been grappling with some of these issues even from before COVID, because quality has always been an issue even before COVID. But now during COVID, it was even more of an issue. More of an issue in the sense that even those frontline, I call them frontline soldiers in the education system, the teachers, were taken aback by the fact that schools suddenly were closed, and then the teachers found themselves at home, and then the next thing they heard of is like, you need to support children. And then of course quality would have to be compromised. But then the other thing that made that quality also be compromised is that the parents who are used to sitting back and sending their children to school and expecting someone to be at the back end trying to teach their children was now given the task of, please look at what your child is doing and please try and respond and please try and support. And those parents found themselves in a very unfamiliar ground. And so that compromised quality. And that's why I think that in a post-COVID world, we need not just throw out that there is online and there is TV and there is internet, but that how is each of these gadgets going to be used, and whoever is going to be at the back end trying to get the teachers and the students and the learners and the parents on board to be able to understand what it means to be able to project something online. Otherwise, then we will be saying children are learning, but we will also be compromising quality and going, like, let's say, many years back from the fight where we started with access and then we went to quality. And I think this has been there for a long time. And we are no longer only talking about access to learning now, but we think that learning should be of quality.
Absolutely. I want to beg for indulgence for at the most 5 minutes. For everyone else, I want to go back to the panel and ask this question about, we're all going back to school, especially in January. Everyone, as we've seen through the presentation, every government, it's sort of a human nature that we cannot continue in lockdown forever. So whatever it is, it appears we have to go back to school in January. How do we look forward? How do we go forward in this sense? If I could take a minute from all my panelists to sort of crystallize on this issue and sort of give us this, how do we go forward with all the issues that we've spoken about today and prevailing circumstances? What should we be looking for? What should we be looking out? And how can we make it much safer, not only for kids and the entire world in this continent, but how do we make it so that this time is not just a decision that is made only by government, but everyone is included? Let me start with Mona. If you could take 1 minute, and how do we look forward to these times in January when kids are now starting to go back to school? If Mona is having internet issues, that's fine. Maybe Dr. Kasahun, if you could take 1 minute just to sort of start wrapping that up for us.
Yeah, thank you. In fact, I tried to, by the way, had a chat with one of the school leaders in Ethiopia, and in fact, a bit far from the center. And what are the current challenges which are facing the current education system after reopening school? You know, initially some plans have been made, serious plans have been made, they are really appreciable. But there are unforeseen things which are happening in the school. For example, people the new way of life is they cannot share books, textbooks, pens, and other things among their friends because of avoidance of this touching. In that case, what happens are some, especially lower grade students, are feeling very much annoyed with that. And they are also losing some peer learning, which is to be group discussion, which is to be one of the supportive methodologies of teaching. In this case, it is avoided. They have to keep distance. And this is causing some kind of concern among students. And on top of this, the sanitizers, the masks are provided by the government. But sometimes, you know, the students are sharing masks in the shift system. For example, morning shift students will provide to their relatives or some friends the masks to the afternoon shift students. And using masks are causing some discomfort on the part of students. They don't cover their nose and mouth. Instead, they just cover the mouth and leave out the nose. These kind of things are happening. Therefore, every precautionary measure has to be made, and the orientation, sensitization has to be made when we are opening schools. Otherwise, very difficult things are happening. And the other thing is introducing 3-shift systems is causing some serious problem. For example, the first morning shift, students have to start the education as of 7:30 in the morning. And if they are coming from long distance, they have to travel maybe starting from 5 a.m. And this is causing some serious concern. Sometimes they are confronting with wild animals, sometimes gangs. So even those who are coming, who are returning back in the late afternoon, the 3rd shift, they are going back to their house late afternoon in the evening time, and they are facing some challenge. So these things are causing some serious concern. I think governments have to try to critically see these things which are bringing some consequences in the learning process. Thank you.
Thank you very much. Maybe I can ask all my panelists just to get their cameras on in the next 1 minute as we wrap up. Bente, I would ask the very same question. Kids are going back to school in January. What surely can we learn? What can we say with, you know, all the opportunities and the limitations that we have to make sure that it is safe and it's productive for everyone?
So my take would be, for those countries who have not done anything, who are not like Rwanda, have makeshift classrooms, because you're not going to build them between now and January 4th for the case of Kenya, and ensure that schools now begin to put in place, begin to put in place the health protocols that are supposed to be in place, like hand washing stations and, you know, and have sanitizers, and somehow maybe from capitation grants, or if the government can get something. But most importantly, I think communities and parents will have to be a very key part of going back to school. How do communities support what is happening in the schools? Because now it is very clear that the schools might never do it alone. They have never done it. We have left it to the schools to figure it out. They are not going to figure it out now in a post-COVID world because they can't. And so it is incumbent on every government, whether we will like it or not, to be able to involve their communities and use community resources, but also to bring parents on board to do their part so that learning can continue in school, but also beyond the school. That is my take. Thank you.
Thank you very much, Moses. 30 seconds or less. How do we move forward?
Moses, you're on mute.
Sorry, thank you. I think, as I was saying, I'll give my reflection will be at the system level. And the first thing that I thought that I think needs to be done is planning. We don't need to deliver, for example, the PPEs to school. We'll need water in schools. We'll need instruction. We'll need teachers to teach. And all that needs to be synchronized. So plan. Two, we also need to adapt it to the local context. For example, I have a classroom of 25. When it comes to social distancing, that is different from a classroom of 100. Probably I need to make a makeshift classroom. I need to ensure that my 100 students are also practicing social distancing. So adapting to the local context becomes very, very important. And finally, is scaling the positive impact of what we have learned, of what is working. That way, we continue closing the gaps and continue adapting, for example, we have learning loss. What is that can help us close that gap of learning loss? We have children in marginalized areas who are not being reached by the existing technology. What is that is working in other contexts that we can contextualize, we can adapt so that we reach them? Those would be my reflections.
Okay, thank you for the absolute final word. Allow me to ask Dr. Catherine. We've spoken about education for the last hour or two, but this is really a health crisis. We are really not out of the woods yet. How do we look forward to going back to school with this virus still hanging over our heads?
I think most of the panelists have really alluded to some of the things I had. Expanding the existing infrastructure. I think the existing classrooms need to be expanded, tents, makeshift, whatever you want to call it. I think that's what is it called, a reducible minimum. There's some term that is quite popular here. But then other than that, I think you need also the public health system to support this process. For instance, there's a test which has been approved by WHO that does rapid tests. You don't need PCR that takes 48 hours to get results. It has been approved, and that will be a critical tool so that if you can even test children every day before they come to class, they are positive, they go back home. Or the parents can test them, and if the kids are positive, they don't come back home. But really, we need the supportive public health infrastructure that for this kind of new initiative, that we're able to rapidly identify problems and snuff them out before the virus starts spreading again back to the communities, the teachers, the parents, and all their social networks.
Okay, I want to thank you all very much for making time to have these very important discussions. The recordings are going to be there. Thank you all for your time, for all your questions. I want to commit on behalf of the HRC that the PowerPoint slides will be shared with partners and friends who asked for it. Dr. Catherine, Moses Ngware, Dr. Mona, Dr. Tilai, Dr. Benta Abuya, and everyone else who's been involved in the background to make this possible. Thank you all very much for making for this this afternoon and spending your time for this discussion. Thank you all.
Thank you.
Thank you.
Thank you. Have a good evening. Bye. Good evening.